Mizoram has reported over 1,000 fresh COVID cases for a fourth straight day on Friday, as 1,055 more people, including 185 children, tested positive for COVID, taking the tally in the state to 69,026. The death toll has risen to 231 as one more person succumbed to the disease. The daily infection rate, which is the positivity rate, is at 10.77%. And 2 fresh patients have travel history. The remaining were found to have contracted the infection locally. The northeastern state has registered 1,061 new cases on Thursday, 1,200 on Wednesday and 1,400 on Tuesday. Let's go right across to Ratnadeep, tracking the details of this story. Ratnadeep, a worrying surge in coronavirus infections being reported in Mizoram. Over 1,000 cases daily for 4 straight days, and the positivity rate has crossed 10%.
That's right. This is an alarming situation. In fact, in Mizoram, for the past 4 months, there have been one of the most strictest restrictions if you compare to other states in the northeast. But if you look at the scenario and the data that we are getting from Mizoram, not only that in the last 4 days there have been fresh cases which are more than 1,000 daily, but in the last 7 odd days, the range has been between 700 to as much as 1,400. So this is an alarming situation. Now, what we are picking up from state health department sources is that one of the reasons they are citing is a high testing rate. Mizoram has one of the highest testing rate in the northeast and as compared to other parts of the country. But given the fact that the positivity rate had remained over 10% for a long time, and in fact the recovery rate in Mizoram is just slightly about 80%, perhaps there is a need to look at the strategy that involves in terms of combating COVID-19 in the state. Also, very alarming is the fact that more than 10% of the fresh cases are children. So children are said to be the vulnerable group as far as the the third wave is concerned, if any third wave hits the state, because the state is still combating the second wave. And it seems that 90%, over 90% of the cases are within the community, within the state, locally transmitted. So it seems that over 4 months that there were strict lockdowns, and even now with partial reopening, but there are strict restriction in place, the chain of transmission could not be broken in the state. So that's something which should be a cause of concern, not only for the state government but also for center as well. Also, the fact that in Mizoram the state government has done fairly well in terms of the vaccination program. Now, close to 60% of the population have received at least 1 dose of the vaccine. About 25% of the population are fully vaccinated. So one has to look into whether there are breakthrough infections also are taking place in some parts. Particularly, these cases are coming from state capital Aizawl and the suburban areas. So there are parts of Mizoram where the caseload is really less. Also, the fact that in the border areas you have refugees coming in from Myanmar, so that also is a cause of concern. Now the schools are open in different parts of the state, so therefore perhaps it is time for the state government to look into its strategy of combating COVID.
Right. Thanks, Ratnadeep, for joining us with the very latest. We will, of course, continue to keep a close watch on those numbers emerging from Mizoram. COVID surge there being witnessed in the northeastern state.